So, what does a compassionate focused school look like? Let's go ahead and proceed. The model we are going to share with you, we are sharing with you today, has 5 basic components. In addition to the 4 quadrants you saw in the previous slide, and we're going to look at again, we have something called heart-centered learning. We have an approach to teaming. We have the instrument to help measure progress with building a compassionate environment. And then there's a process of visioning. Next slide. So looking at these 4 quadrants, if you want to take a moment and in the chat box, enter in the area where you think you do the best job. We know that many schools have social emotional learning programs. Maybe they've had some training so that they're on their way to becoming a trauma-skilled school. And we like to differentiate. Trauma-informed means that you really have the information. Some of it may be at an awareness level. You may have had a couple workshops, you know, something about the neurobiology, but trauma-skilled means that you're really actually pretty good at using those skills on a day-to-day basis. We know too that it's so important to network together, to get the wraparound services, to consider, like if you're working with a mental health provider who's supporting your schools, do you have someone who can come in and co-teach classes at all? Can you do some problem solving? What do you do with kids during crisis mode or as they transition back to school out of a crisis? Or maybe it's a student who's been receiving some support and now is you're trying to wean the student from that support. Maybe the student is graduating. So all of those things are really important. And those supports can be provided by counselors, but we also know that teachers have a role too. And that, in fact, we think about everything we've been hearing about executive function. If children are seriously impacted by trauma, then their brains are going to be doing things that will pull them away from the academic learning. They may not want to sit at a computer screen for hours doing math problems. They may not want to be in a classroom listening to a teacher lecture. They may not want to engage with their peers in learning, sometimes because they just have this sense of fear or feeling a sense of danger. And you know that sometimes this acting out will result in them being silly, you know, doing things just to get off task, to be the class clown, to be dismissive of us, to be angry. All of those are things that kids do when in fact they're struggling. And it used to be that we would try to manage the behaviors. Well, now we're saying, you know what? It goes beyond that. Because if you're just managing it, then sometimes there's a resentment, sometimes it's just surface learning, and sometimes there's deeper needs that aren't being met. And in fact, from all the ACEs research and other research on adverse childhood experiences, we know if we don't address them during childhood, then in fact they can multiply and grow. And as adults, people can have serious problems, health problems, heart problems, diabetes, overweight, using drugs, engaging in risky sexual behaviors. All of these are ways to escape the trauma that we may not have addressed. On the other hand, there are some very simple things. Some of them are amazingly simple to help build resiliency and show or how we can be protective. And I use the word show intentionally because I want kids to be able to have a sense that in fact, I'm here to help. And I'm confident that in fact, I can do something to make your life better, even if it's in a small way. So good listening skills are really critical. Asking how kids are doing, finding that way to have a small, more intimate conversation even online. I know some teachers will have virtual appointments. Sometimes they'll have peers in small breakout groups so that they can handle issues. Going back to the screener, the COVID screener, you could even take those questions and do an analysis and say, which kids have certain types of problems? What can I do? Maybe there's some cluster grouping we can do to help those kids. And I want to just really reiterate here the importance of working together in a community what? Learning about what parents know, where their needs are as well, where their strengths are, how they can help, but also how do we engage them? How do we engage with our outside service providers? So in fact, we're all working together. Next slide. Okay, we have a process that's called heart-centered learning, and we'll get there in, I think, in a minute, but it does relate to this compassionate mental health model. And what I'm going to say up front with this slide is that both systems, they connect, and they need caring and competent leaders. Caring alone doesn't do it. Competent alone doesn't do it. It needs to be the combination. And sometimes we get really good schools and we have principals and assistant principals, deans of students who fit that. It's wonderful. And sometimes we're not there. And so sometimes it takes someone else to take on some of that leadership or to help inform, nudge, etc., our leaders so that they learn the skills that are needed to help. And one of those skills is self-care. And we'll get to this in a minute. But the important thing to know is if, in fact, we want somebody to be mindful and present and able to understand kids and to help them build their resiliency, then in fact, we have to take care of ourselves. And too often right now, and we've done some research on this, we did some research this spring, too often right now, we are so busy, we're so stressed out, getting those foods, lunches packed, the meals packed, right? And thinking about what we're going to do, how are we structuring our lessons, and what's it going to be like, and how can we be assured of safety? So many times we're right there that we may not take the time to take care of ourselves. And so one of the things we've learned to do with the people we work with is to always ask, like, how's it going? What are you doing for your own self-care? Is it a walk? Is it a few deep breaths? Is it yoga? You know, there are lots of things you can do. Physical activity is important, but also just taking a few deep breaths at times is very important. And then last thing about this slide is that we want to work with homes and schools and communities to develop a collective vision so that in fact it's just not you down in room 10, or it's not only the second grade teachers who get it. It's everyone. And we're working towards that goal of a whole system so that kids who are in first, second, third, fourth grade, etc., all have compassionate, caring teachers, all have teachers and other providers, psychologists, counselors working with them to help develop their own sense of well-being. And there are very specific techniques we can help you with. And I have to tell you, there are also considerable barriers. If kids have experienced trauma, sometimes it is not easy to reach them. There's sometimes distrust. Sometimes they think if they let down their guard, that in fact someone will take advantage of them. So it takes a while, but consistency is really important. Next slide. There's the 5 C's. We are so pleased about these 5 C's. I worked in India for a while, and you know, I'm a yoga teacher in addition to being an educational psychologist and over 30 years of experience in education. But when I was in India, I said, what is it that I loved about being with the students who meditated quite a bit, who in fact were conscious of their own self-care? And I realized at that time, this was back in like 2009, that I couldn't bring all that back to the United States. But what I could bring back is some of the underlying philosophy. And you can look at these words. It's not only Eastern. A lot of it comes from positive psychology, from educational psychology, from knowing what kids need to do to feel safe and secure. So first one is consciousness. Be aware. Second is compassion. But you have to practice that. When you practice, have a feeling of success and security, you gain the confidence with compassion so that you can stand up and help yourself, you can help another student, and you'd have the courage to do that. And there are exercises we can go through to help build courage and resiliency. All of this results in more compassionate action, and it's done within a community setting. So building community is also critical. Next slide. Just want to say, we have some books on this, but Jeff Donald is a mindfulness coordinator in Montgomery County. And when he talks about these 5 C's, he said they're so important to healing and to actually integrate them into the curriculum. So they're not something that's an afterthought. It's not only after school, it's not only for some kids, but it's something that everyone can appreciate as they learn history, English, math, art, whatever. There are ways to do it in a compassionate way.
Thanks, Chris. And we, as Martha mentioned, we've done a needs assessment in the Maine region, but we also work with some Maine school leaders. And we spoke with Principals Jamie Ella and Kristen Levesque, who are CTLC fellows, who are here with us today about some of the challenges that they had in their schools. And they really mirrored some of the things you all expressed in the breakout rooms, as well as the poll earlier. Lots of increases in home challenges, is relating not only to abuse, but also poverty, more adverse childhood experiences as well. And they joined the Childhood Trauma Learning Collaborative because they wanted to learn more about how to cultivate that mindfulness and all of the things that Chris has just mentioned. So I'd love to now invite Kristen to tell us a little bit more about her school and why she thought it was important to join the Childhood Trauma Learning Collaborative. Well, while we figure out Kristen's tech problems, I'll introduce you to Jamie Ella. She's also one of our Childhood Trauma Learning Collaborative Fellows, and she is principal at Libby Tozier and Carrie Ricker's schools. So Jamie, do you want to go ahead and introduce your school and why you joined the Childhood Trauma Learning Collaborative?
Hi, mine's working. I can talk if it's easier, but it looks like you have.
Sorry, Kristen. Go ahead, Kristen.
So I work at Marana Cook Community Middle School, and we have about 285 students, 30 teachers. We're a pretty focused school on trauma and trying to support the students' needs. We think a lot about Maslow's hierarchy, and we aren't really, we won't be able to teach kids or instruct kids until they're able to be present, and that means that they're feeling safe, whatever that might look like. So for us, what we've been working on is really identifying our strengths and weaknesses, and that's something that we need to do all the time. And then I've been using a lot from the fellowship program to help support me in what that looks like. So a lot of more focus. We have done a ton with restorative practices, but there's been more of a focus in the past year or so on mindfulness and building mindfulness into the classroom in new ways. We've done ACEs training. Like I said, we've done a ton with restorative practices. And then what we try and do is we try and just have social emotional learning and, all these parts of building a whole student integrated and embedded in everything that we do.
Thanks, Kristen. Now, Jamie, we'll turn to you.
Hi, I'm Jamie Ela. As Dana mentioned, I work at Carrie Ricker and Libby Tozier schools. They're both in the town of Litchfield, which is not too far away from where Kristen is. We're kind of in the same part of the state. I have pre-K through 5th grade combined between those two schools. I do not have 325 teachers at Carrie Ricker. I wish we had one-to-one. That would be great. We've done some things since we started my work with CTLC. We've started using some calming corners and calming baskets in different classrooms. Lots of students coming into school who are living in severe poverty. There's a lot of drug addiction. Multiple students in my first year in the district lost a parent in some sort of a car accident related to substance abuse or other things connected to that, which was devastating. It's a little bit different area than where I live, but it was shocking to go through that my first year. I think we lost 7 parents my first year in the district. There are many students being raised by grandparents. We have a high percentage of foster children, as well as adopted children, which is amazing to see, but also brings with it quite a bit of trauma. We have behavior rooms in each of my schools that I work in, as well as other schools in the district, which is not something that I'm used to at home. So just the level of trauma with most of the students in those rooms is pretty huge. So these calming baskets and calming corners and things that we've started doing have given kids strategies to really determine when they need to stop, take a break, and not, you know, have a meltdown or need us to evacuate a classroom. That's been a little bit eye-opening as well. The classroom evacuations do not go over well with parents, as well as they do interrupt the day pretty strongly. So we're working on ways of getting children to really focus on what they're feeling and finding ways to use different strategies to support that. So I've learned a lot of different techniques. We're using the toolkit right now that was mentioned earlier by Martha to kind of look at our reentry with COVID. Another piece, we've gotten some grant money. I don't know if that will be highlighted later by Dana or Chris or anyone through CTLC that has allowed us to purchase some of these items to support those calming baskets and corners. We have used the SCATE to really look at what staff are feeling about the trauma impact in our schools and the path to move forward. I started a behavior committee with one of my schools, and we're hoping to start one at the other school as well as we begin the new school year, which really brings teacher voice into the process and determining the path that we follow based on the data that we have from the survey. So that's kind of in a nutshell what we have going on. I'd be fine to chat with people later or answer questions via email if anyone has them. Thank you.
Thank you so much, Jamie, and Kristen, for sharing about your journeys and the CTLC, how that's been a part of them. And yeah, Jamie mentioned the Heart-Centered Learning Grants, which are available to any CTLC fellow or member schools. And we will talk later about how you can join us in our Learning Collaborative to learn more about childhood trauma and gain free resources. So as Jamie and Kristen alluded to, a lot of the work that we do in the CTLC is around mindfulness and its neuroscience proven ability to improve executive functioning skills, including those listed there, but also emotional well-being and social emotional intelligence as well. So we're going to talk now about some of the reasons why it's so important to use mindfulness. When we use mindfulness, one of the big things we think about with helping with those behavior disruptions is increasing self-regulation, or the ability of a child to resist those impulses to use those distracting behaviors. And there's a really specific process that they can go through to help improve their self-regulation, which goes through a few different things, including becoming more aware of their emotions, that consciousness foundation of our 5 C's. And then learning how to cope with those big emotions. And doing mindfulness practices can be a great way to soothe anxiety, to lessen depression, and address a lot of those big negative emotions that young children, all the way up through high schoolers, don't have the tools to cope with. Another way that mindfulness helps is that it just increases a child's ability to be in social interactions. Those children who experience trauma, a lot of the times, they interpret neutral situations as threatening and dangerous, and they may react with violence or an overreaction of yelling or getting more upset than might be warranted. And so practicing mindfulness can help bring those big emotions back down to a manageable state. Decision-making, memory, mental flexibility, all of those executive functioning skills are also improved through a regular mindful practice. And that's really the key there, is regular, which is why we advocate for it being done in the school day, in the classroom, as much as possible. So let's just talk about a few different ways that we can integrate mindfulness. And if you join the CTLC, we are constantly sharing ideas like this. These are just 4 that another CTLC member, Kate Retzel from Lee Elementary in Lee, Massachusetts, that her school has used. They have mindful moments, meditation moments, where maybe at the beginning of the school day, or right after you return from lunch or PE, or even before a test or a presentation, all of those are really great times to do a little yoga, do a little breath work. And we have lots of ideas in our books and on our blogs for you to look at, lots of evidence-based, proven methods of helping kids not only become more aware of their emotions, but cope with those big ones. Another one that they use at Lee is the feelings thermometer. Some of the teachers have this printed out and it's on their little badge. And so they can just show it to students and ask them to point to a face or pick a number to get more in touch with their feelings and also express it and normalize these feelings. None of these feelings are wrong or bad. We just have to make sure that we're expressing them appropriately and safely and respectfully. The next one there is Washington Worrywart. Now, Washington is Lee Elementary's mascot. And so you could pick whatever your mascot is. They just took a sock and sewed a zipper in it and put the sock over a pot, and the zipper unzips, and the kids get to write their worries on a little piece of paper, fold it up, and stick it in Washington Worrywart's mouth. And then they don't need to worry about it anymore because he's got it covered. So that's a really great way for kids to feel like they can release or let go of any worries that they have, and also a great way for the teachers to figure out what's going on in their classrooms. You could come up with an online version of this, maybe a Google form or an anonymous or a chat box. You could do a chat function and make sure they know that it's going to be private and you won't share it with anyone. Another great way is to do a writing prompt. This can work especially well for older kids. We can give them a writing prompt about a specific situation, or just using, "I wish my teacher knew," and letting them fill in the end of that sentence. Some teachers have shared with us that they've gotten responses such as, "I wish my teacher knew I didn't eat dinner last night," or "I wish my teacher knew that I have to pick up my younger brother from school every day before I go into work." So we can learn a lot from our kids if we just give them the opportunities to reflect and to learn strategies to calm those emotions and recognize them.